Okay, Mr. Fernandez, my shift's coming to an end and I'll be leaving soon. The oncoming nurse and I will be coming in to give bedside report, and we encourage you and your wife to be involved in the plan of care for the day. We only have a short amount of time to give a report, so if there's anything you need before I leave, I could take care of it right now. How's your pain, or do you need to be repositioned?
My pain is doing well. I'm using this button right here.
Okay. And do you need to be repositioned?
And no, but I would like another pillow behind my head. It'd be great,
Sure.
thanks.
Do you need to use the restroom?
No, thanks. I have been assisted already by the other nurse.
Okay, the oncoming nurse and I will be back in a few minutes, and we encourage both of you to be involved in the plan of care as much as possible today.
Okay, thank you, Patrick.
See you then. Mr. Fernandez, this is Anna. She'll be taking over your care now.
Hello.
Good morning.
Anna, this is Mr. Fernandez and his wife Judy.
Hi, nice to meet both of you.
There.
I'm going to put my name on the board so you guys can remember it, okay?
All right.
Mr. Fernandez is a 52-year-old gentleman who was admitted to the ER last night. He lives with his wife Judy and was found down at home. They also noted he had lower extremity swelling for 5 days and was experiencing some shortness of breath and weakness.
Yes, he did fall down in the bathroom last evening. I don't believe he lost consciousness.
When they arrived to the emergency room, he was found to be in atrial fibrillation with a rapid ventricular rate between the 150s and 160s. After 2 boluses of diltiazem, he was started on a drip. He has 2 peripheral IVs, an 18 gauge in his left hand and an 18 gauge in his left.
Can I take a look at your IVs?
Both were started in the emergency room.
Okay.
Okay. His previous medical history includes hypertension and an MI 2 years ago, as well as CHF. These are all written on the Cardex, so you can take a look at these a little bit later. He's allergic to penicillin, which causes a rash. We can go over some labs. In the emergency room, his BNP was 1700, and he was given a total of 80 milligrams IV Lasix after a Foley catheter was placed. His potassium was 3.5, and he was replaced with 40 MEQs of potassium chloride. His cardiac enzymes were negative ×2, but you're going to need to draw the 3rd set at 10 a.m.
Okay.
I'm going to open up the plan of care. We can go over that. First one is impaired breathing related to pulmonary edema. Currently, he's on 2 liters nasal cannula. His SAT's greater than 93%, and there's an order to keep his O2 SAT greater than 92%.
Okay.
Okay.
And how is your breathing doing?
Feeling much better, but I'm still getting a little winded.
Okay.
First problem is going to be impaired cardiac tissue perfusion related to the AFib with the rapid ventricular response. As I said, he was started on a diltiazem drip in the emergency room. We'll go over the dose and the EMAC, as we said, in a minute. He's currently in AFib, in a heart rate of the 80s, and his last blood pressure has been stable, 1 teens, over 70s to 80s. Mr. Fernandez is a high fall risk because he fell at home. His bed alarm is on at all times and his call bell's within reach.
Bed alarm's on.
His call bell's within reach.
Okay. Mr. Fernandez, since you fell at home, you're considered a high fall risk, so we need to keep the bed alarm on at all times, okay?
Okay.
And if you need any when you get up, you need assistance, so make sure that you call when you're getting out of bed.
I will use this red button on this.
Okay, so we can count on you guys to call when you need help, right?
Right, and that bed alarm is very loud.
I know, but to ensure safety, we need to keep it on, okay?
Okay, I understand.
Okay.
And the next problem we have listed is going to be his skin integrity related to his fall. He's got some ecchymosis to the site where he fell last night. It hasn't gotten any worse. X-rays were done and they're all negative. H&H and his coags are stable. Fourth plan, pain, treating the pain in his right arm. You've started on a PCA morphine. 1-to-1 concentration. He's ordered at 0.5 milligrams every 10 minutes, and he's got a 3 milligram hourly lockout.
Okay, shift total is 8 milligrams, 16 injections, attempts over 23 attempts, and there's 40 milligrams left in the syringe.
Okay.
Can you go ahead and clear it?
Yes.
Okay. What is your pain level right now?
My pain's doing good.
What are you rating it?
I'm rating at about 2.
Okay.
And the diltiazem drip is currently at 10 milligrams an hour. We are to keep his heart rate between 80 and 90 and a systolic blood pressure greater than 90. We need to double check the original orders, the rate and the dose. The plan for Mr. Fernandez today will continue to diurese him with 20 milligrams of Lasix twice a day. You're going to be on a 1 liter fluid restriction today, sir. We're going to need to keep your O2 saturation greater than 92%. There's an order for an echocardiogram, which will come into a bedside, and we will continue to control your heart rate and blood pressure on the diltiazem drip.
Mr. Fernandez, do you have any questions regarding your plan of care for today?
No, I don't think you.
No, I understand. Thank
Okay.
you.
And in order for you to go home, Mr. Fernandez, we're going to need to diurese you, still continue to diurese you. You're going to be needed converted from IV to a pill form of the diltiazem. You'll need to be on that stable for 24 hours before you're allowed to leave.
Okay.
We also need to wean him off the oxygen, get you back onto room air,
Okay.
and as well as we need to increase your activity and get you out of bed.
That's right. Yes, I understand.
Okay, I'll make sure I start the core measure for heart failure teaching.
Okay, Mr. Fernandez, I'll be leaving now, and if there's anything else I can do for you before I go, just let me know.
No, Patrick. Thank you for your care.
Thank you very much.
Sure.
I need to go get report on my other patients, so I'll be back in about 20 minutes, but if you need anything, make sure you call, okay?
Okay, thank you. Sounds great.
You're welcome.
Hi, Anna.
Hi, Brianna. You're going to be my CCP today in room 305 with Mr. Fernandez. Can I give you a report right now?
Sure, now's a good time.
Okay, Mr. Fernandez, he came in through the emergency room last night with his wife. He's going to be on a 1 liter fluid restriction, so make sure he doesn't go over that, and you keep track of his eyes and nose, okay? He's also a high fall risk because he fell at home, so make sure his bed alarm's on at all times and his call light's within reach. And when he gets out of bed, make sure that he always has assistance and don't leave him unattended. Don't leave him alone, okay?
Okay, that sounds good. Maybe we could alternate the hourly rounds. I could do the odd numbers and you could do the even hours. That sound okay?
That sounds good.
Okay, sounds good.
And could you make sure he has all of his supplies for oral care and that you offer him a bed bath later?
Sure, I'll ask him a little later in the morning.
Okay.